Lovely to be here, thank you, and an august panel. I guess I'm the interloper. This is supposed to be a US-Canadian conversation, and all of a sudden some bloke drops in from down under. And whenever there's a challenge on, I heard Paul say this morning, you wanted to make sort of an inter-country challenge, and I said, hang on a minute, you know, we love a fight. Now, we'll be in that, and I'm sure our Kiwi cousins across the ditch will be in it too, because, you know, they really get upset by Australia beating them, and just a bit like Australia gets upset by Canada beating us or the US. So it's good to be here. I haven't got very long, and I was reflecting on what to say, as many have said this morning, and you generally throw out what you're going to say by the time you get to this stage of the day. But I will say this. I think the General's comments this morning about we've got to do a lot better in terms of the science of our efforts in this space. We've been, I think, rather derelict as communities in terms of investment in mental health research and the function of brain, the impact of trauma. We know childhood abuse, neglect and trauma is the strongest predictor of later development of mental health problems and suicidal behaviour in adolescence and adulthood. We really haven't found why that is. What are the genetic and epigenetic changes that are occurring in the brain? And we're only just starting to, you know, open up that evidence base and are starting to see some improvements. And the linkages that he was referring to between acquired brain injuries, PTSD, Parkinson's disease, multiple sclerosis, they are all part of the, they are interrelated. They are not separately diagnosed nor treatable in a sense. So we do have to have much more collaboration around this, and certainly the Brain and Mind Research Institute in Sydney, where I teach and research, 22 full-time professors there, an entourage of others. They come from a diversity of disciplines, and they're all focused on finding breakthroughs in these things. But it's not more lab rats, it's not more zebrafish that we actually need. We will find why we can produce better results for people with those sort of conditions. But we actually have tools already that can ameliorate these conditions right now. And we need to actually upscale them, make them more available across our respective countries. I've written and co-authored and commissioned about 1 million words on mental health services and mental health reform in the past decade, so I'm not going to try and condense that in the remaining 5 minutes. But I will tell you that we haven't really got anywhere in terms of tackling this problem in Australia. We've had a national suicide prevention strategy for 2 decades. We have not made a single dent in that. We thought we did for a while, but we actually realised we were miscounting. We couldn't count for a while, and we found that we've been underreporting significantly through the early 2000s on suicide deaths. The official stats for 2012 released by the Australian Bureau of Statistics show that 2,535 people, the highest number in over a decade, died by suicide in 2012. Now it'll take us another 2 years to actually figure out, is that actually the number? And when we see the result in 2016, it'll tell us officially that it's probably about 2,700. Now, Diego De Leo at Griffith University in Brisbane has found that, in fact, even when that's done, we'll still be about 15% off the mark, because suicide is difficult to identify. But I think we've got evidence around the world, in Ireland and Scotland in particular, where they are counting better than any of us in that exercise. And that's an important, I think, precursor, if you like, a precondition to actually being able to be confident that we are making a difference. I loved Deborah's confidence in the data that she's able to present from her workforce. That's what we need at national and state jurisdictions. The bad news in Australia is that we have really been underspending in this area grossly. We spend about 80 cents per head of population on suicide prevention efforts every year, 80 cents. We spend 15 cents on suicide prevention research. But the good news for you guys when you travel down under and go swimming is we're actually spending more money on deterring sharks and finding out why sharks bite people. We're spending more money on that than we are on suicide prevention research. Ridiculous, isn't it? There's 1.1 deaths per year in Australia from sharks. So what else can we say very quickly? You can look at that report. That is a review of Australia's mixed success on mental health reform and suicide prevention over the last 30 years. My good friend Angus Houston, who I was talking to the General about earlier, he's our former head of Defence Force in Australia. His number one mission in his post-ADF life is looking after the health and well-being of the 26,000 young Australians who have served in Afghanistan. That's his number one purpose. And he serves as the chair of one of those bodies that I am a member of. Where we've done reasonably well in Australia are these four areas that I've circled. We have made access to primary mental health care through GPs, through psychologists, more affordable, more accessible, not necessarily a whole lot more effective. We're working on that part, but that's been a big breakthrough. Related to that is a lot of work I do in the area of service integration. We know that people with mental health problems, people with suicide ideation need integrated services, and that's been a big focus there. But the two big key areas are around where we've made big progress, I think in the last 10 years in particular, are around integrated youth mental health. And we have a national service system now designed for 12 to 25-year-olds to access care at the very time we know that the effects of mental illness and suicide ideation will start to manifest. And we are making great strides, and I'd say, without being too boastful, we are probably the world hotspot for e-mental health programs and applications. And the Young and Well CRC, James Hopkins down the road here, or across the road that way, is actually a participant in that major partnership. Very quickly, whoops, missed that one. I want to just focus on Mates in Construction. Mates in Construction is an initiative running in 4 jurisdictions, 4 states in Australia. It's shown remarkable success in the construction area. So just as Ron was saying, it's a big problem, and the evidence from down under is the return on investment. Sally referred to this morning, 4 to 5-fold return on investment for the companies that are actually engaging with Mates in Construction, and AusHelp, which is the other one working in this area. And a key partner in that has been the superannuation fund, our pension fund for the construction industry. They have been a funder of both of those, all three of those organisations on the board. Time doesn't permit me to go on, but happy to discuss any of those in the break and the other programs there. But I do really want to reinforce a point that came up this morning. It is not just about, it's more on this slide, it's not just about training programs. And I think Deborah's point about culture, about some of the other points here, David made the point earlier, we do have to undertake broader cultural change, and suicide prevention, mental health initiatives have to be part of an overall strategy within an organisation. So if you have programs that are tackling diversity, if you have programs tackling bullying, these are complementary to efforts that are specifically around suicide prevention and mental health promotion. Thanks very much.